It's on the minds of a lot of parents right now, the fact that their children are playing competitive sports and they're concerned about their general health. In the past week, 2 teens, one from Fort Collins, another from Michigan, died after playing in their high school games. The 16-year-old in Michigan, Wes Leonard, died of cardiac arrest caused by an enlarged heart. The Larimer County rugby player, 17-year-old Matthew Hammerdorfer, also died of cardiac arrest. Some wonder if an AED, automatic external defibrillator, could have helped in these cases. In one case, as 9 News reporter Corey Rose explains, it did save a girl's life.
I have been told by every cardiologist I've spoke to, if the AED wasn't there, I wouldn't be here either.
Lindsay Hayden is the spokesperson for Save a Life Denver, a program that advocates to have AEDs available in all public buildings in Colorado.
They still to this day don't really know what actually caused it.
Lindsay was in her 3rd year at Stanley Lake High School. She was sitting in class talking with friends when all of a sudden she collapsed to the floor.
Everybody just started freaking out.
Her friend knew something had to be done immediately.
He said that I just started gasping for air and then I stopped and I turned purple, and he told me he's never seen anybody, he didn't even know anybody could turn that color. He immediately started CPR while 2 other kids ran and got Officer Dan, who ran in with the school's defibrillator. They shocked me twice. The first time it didn't work, and then the second time my heart finally just started to develop a rhythm.
The AED saved Lindsay. It was the same one given to the school just a year before.
It was donated by Howard and Susie Lunger, whose son was also a student at Stanley Lake, but he died from sudden cardiac arrest the year before. The Lungers, God bless them, donated an AED to Stanley Lake High School in memory of their son Dan. And that AED, had it not been there, Lindsay would not be here today.
Although using an AED can be intimidating to some, Dr. Chris Caldwell from Denver Health says it's simple.
You cannot hurt people with this. It does sound scary, electricity and that's going into people, but it literally will not let you do it unless there's a situation where it's necessary. And so the nice thing about these machines is you can do no harm and you can save a life.
As Howard Lunger has so often said, somebody that goes into sudden cardiac arrest is essentially dead. You can't make them deader by using it. All you have to do is be able to listen, because the machine tells you exactly what to do.
Apply pads to patient's bare chest.
Dr. Caldwell says sudden cardiac arrest in teens is not a new health concern.
It can impact anybody at any time. And sure, it happens in young people, it happens in old people, and we can really make an impact by getting machines like this out and having everybody have access to them.
Lindsay says there's no excuse.
People always put them after a death, and that's too late. I mean, the price, $1,500 to $2,000, you can't put a price on a human life.
Corey Rose, 9 News.
The Save a Life program is now working on a way to tie in locations of AEDs to the 911 system, so when someone calls, the dispatcher can tell you where the closest AED is. How about that? You can learn more about the Save a Life program and about AEDs on our website at 9news.com. They call it resuscitation for dummies, because you can just follow the cues on the machine. And
it's great.
Like they said, you can't make someone deader, but you could yank them out of it, just like this little girl, and save a life.
Look at that. Save a life. There is no price, as she said so eloquently. So hopefully this campaign will really catch on, especially now.
That's a great idea, isn't it? Tying it into the 911.
You bet.
It's a good idea.